Okay, this week's key to success, number 34. Just to remind ourselves how long we've been doing these things. We just did a hangout on Hashimoto's. Okay, much to our surprise, we hadn't in years done one that it was actually titled Hashimoto's. So we just did that, which came to mind a few conversations I've had in the last couple of weeks with patients coming in for consults or reconsults, and the difficulty with, I had my annual checkup, or I went to my doctor for something. They did some lab tests on me, and they said I actually don't have Hashimoto's, or they said I have Hashimoto's, but maybe I should not do this, and maybe I should take these hormones. The complexity of Hashimoto's is hard to overstate. And so we've seen this sabotage people's recoveries, and we've seen them suddenly go off into another direction. And because they've been told that what we told you is not correct, that has taken the person in another direction. That direction frequently hasn't been a good direction, and our key to success this week is.
If we tell you have Hashimoto's, you have Hashimoto's. That's pure and simple.
That's it.
We don't guess on this stuff. And so we're looking at the most up-to-date information. Now, you may go to a practitioner and they're responsible for a whole lot of different things. And we're in kind of an area of chronic pain, chronic disease. We do these broadcasts every week. We attach 40 articles, scientific articles, to today's broadcast, just as an example. And we have references for everything we're telling you. So, for example, with Hashimoto's, it can be really confusing to where LabCorp here in town says you have to have an immune count to your thyroid over 34. Whereas at some of the local hospitals, anything over 9 is too high. A lot of the labs in California, anything over 9 is too high. The Mayo Clinic, anything over 9 is too high. Case in point, because most of you will get the Mayo Clinic. Yet you may have a person that you're seeing here as your practitioner, and you're at a 22 and it's a LabCorp test, and they'll say, oh, well, you don't have Hashimoto's because 34 is a high value. And they're saying that without all that background information. You can see how that would destabilize your confidence. Meanwhile, we have a patient who we know has Hashimoto's, who's getting better, who's having symptoms improve that haven't improved in 20 years through a variety of therapies. And so that's why we can kind of, as one patient termed it, we can kind of politely get pissed off about this issue. I don't like to use that type of language on these broadcasts, but it's true, because we're a little protective over the fact that if you're getting better because we've told you something, it's important that you continue on that same path.
Yeah, Hashimoto's is incredibly complex, and all that needs to be known about it is not known about it. But here's what you do need to know. 5 years ago, people were telling us we were nuts for even considering Hashimoto's. 6, 7 years ago, you said Hashimoto's, and your endocrinologist went, that doesn't even exist. It's like, I don't even think it exists. Well, it existed in our office. It was like 80% of people walked in here tested positive for it. And the journey to figure out how to handle it has been a challenge. And but it is an autoimmune problem, and all things autoimmune have to be handled to calm it down. Technically, it is not a thyroid problem. Your practitioners are still looking at it as a thyroid problem. The Mayo Clinic is still looking at it as a thyroid problem, as per them, not per us. They have put out a communique a couple of years ago that said, we don't know what to do with subclinical hypothyroidism, but 85% of these people have antibodies to their thyroid, meaning Hashimoto's, and we need to do a double-blind national study, government-funded, to figure out what to do with it. Well, that study hasn't been done yet, okay? And they're not, and it doesn't look like it's going to be done anytime soon. So if you wonder why your endocrinologist or your nurse practitioner may not be conversant on this, or we're saying listen to us instead of them, it's because this is what we've been working with. If you want to deal with chronic pain, chronic conditions, things that just won't go away, I don't care if they're dizziness, vertigo, balance, migraine, restless leg syndrome, fibromyalgia, peripheral neuropathy, okay, you have to be conversant on Hashimoto's, or you have no chance. If you've been through this program and you're doing well, and somebody out there is telling you, oh, these numbers are off, or you don't have it, or we're going to change it, you don't need the medication that the doctors that they sent to gave, please, at the very least, schedule an appointment and talk to us first. Okay, so and we've seen it. We had a gal shook up a month ago or so, and this is her problem. This is her problem. When she went to the doctor undermined her confidence. The doctor doesn't know what he or she is talking about
relative to this.
Relative to that.
We're not
relative to this.
We're not
relative to this. It's such a complex subject. And if you look at the hangout that we just did, there is a lot of information on there. And you had mentioned on the previous ones that we did, how many peer-reviewed reference journals did you attach?
In our last 3, we have about 130 to 130.
So we're not making this stuff up. It's out there. It takes 5, 10, 15, 16, 17 years once something is even acknowledged. And this has really only been acknowledged in the general population of doctors for like 3 years that I can tell. Okay. Usually it could take up to 15, 16, 17 years for it to get in there and actually be understood, taught, agreed upon. Here it is. So this will throw you off. This will change your program. This will cause you to do something that's going to make you worse. So in this situation, you have to trust us. You have to trust us on this, and don't do anything that we told you not to do until you call and make an appointment with Dr. Gates and discuss your concerns with him. Okay. That's it.
I'm going to make one last point.
Okay.
Okay, I'm going to keep going. Here's another example. Miscarriages and thyroid problems, kind of an emotional issue. So it's well acknowledged in the OBGYN world that you have to test a pregnant female for her thyroid function, because if her thyroid function is low, then that can negatively affect the baby and the potential, basically the chances of the baby surviving, the pregnancy. And so with TSH, that's a hormone that comes from the brain to the thyroid, telling the thyroid to work. Most medical doctors have been trained, that you're not going to treat that person for hypothyroidism unless that TSH is over 8, and in a pregnant female, probably 5.5. Whereas out of China now, they just attached a study today where they're saying any TSH over 2.5 is a problem. And we've been saying a TSH over 2.8 is a problem. Yeah. But it's just more and more validation that our lab values, as our producer Kevin was iterating before this broadcast, they can be too wide, and we have to tighten them down, because when they're tightened down, then we can see problems more clearly and with more clarity. So,
and we have tightened them down.
Yes, we have. So that's what we're talking about.
Okay.
So if we say you have Hashimoto's, you have Hashimoto's. Thanks for watching. Thanks for watching.
Okay.
Send us your questions, whatever topics you want us to cover. Let us know, and we'll see you next week.